Well, welcome to another episode of the Rainbow Pharmacist. We're here at Queensland University of Technology, QUT, still exploring all of the ins and outs of persistent pain, and we're here today with Tony Hall, who is an exceptionally experienced pharmacist and works at the Robina Pain Clinic, also at QUT, and he's an educator, researcher and consultant. So welcome, Tony. So you're working as a consultant at a persistent pain clinic. Can you kind of give us a bit of an understanding what you do in that role?
Okay. Pain clinic patients, they've all got persistent pain. So the first thing is, I don't question them as whether you've got pain or not. We're not looking to criticise their approach to you for help. We just say, look, pain is what the patient says it is, existing where and when the patient says it does. Yep. And I use that because deliberately it was a saying that came from, I think it was Cicely Saunders initially, and I just use that as my sort of modus, if you like, that you come to us in the pain clinic, you've got pain until you prove otherwise, if you like. So I'll accept that you've got pain and I'm here to help you in managing that with what you have done already, which is usually with medication. Medication, the first line of treatment offered to patients with pain, and that exists into persistent pain as well. And what I'm there to do is to evaluate the mechanisms of the way that they're learning to manage their pain, both from a pharmacological but also non-pharmacological perspective. We're trying to change the patient's paradigm from a reactive approach to managing pain to a proactive approach, and then we're slowly suggesting and showing them that in fact medications aren't very helpful to them, and then we can start to reduce and replace with alternatives. So I'm lucky enough to work in very much a multidisciplinary team where we have the capacity to address all the psychosocial, biological effects which we now recognise as underpinning persistent pain.
Yep.
I've got working with a fantastic team. They are brilliant in terms of their understanding about persistent pain, their willingness to work in a team, and it's amazing how we have learnt to work in an interdisciplinary manner rather than just as a multidisciplinary. In other words, we're each doing each other's roles and jobs as well as our own. So, I'm able to evaluate patients. I've learned to evaluate patients from their psychological and their social environment, and I recognise problems there. I've got other members of the team who are specialists in those areas that I can then refer them on to.
Excellent. Health consumers out there with persistent pain who are trying to navigate the health system, do you have any advice to them, because it can be quite confusing and challenging?
The first protocol is the GP, and you've got to go to a GP and find a GP who is supportive, who understands what you're trying to express.
Yep.
To look at the disease of pain as not being just a failure in surgery or in people not giving me appropriate treatment. It's about, I've got to learn about why am I in pain, how can I understand about what is happening within me, and then be prepared to make the changes to everything else in their healthcare which might improve those conditions. That's what we're trying to do, is that we don't just focus upon the pain itself. We're trying to improve their mental health. We try to improve their activity and functional levels, which is what the physios and OTs do. My role in the clinic is probably the most defined of all of the areas, but I cannot work in that environment without working with my colleagues. So that is a big ask for pharmacists who have little experience in that multidisciplinary team. So for me, one of the prerequisites is understanding how multidisciplinary teams work, understand that pharmacists are nothing special, that we are just one of a number of allied health professions. The number of pharmacists I hear who say, no, I'm not allied health, I'm a pharmacist. No, we're allied health professions.
Yeah.
Whether we believe that to be true or not, but we are, and we need to be within this environment.
Yes.
So I don't make much changes. I make things safer for patients, but it's more about then enabling them to get into, take advantage of the physio and the OT and the psychologist. But accepting, saying, yeah, of course you have pain. That's what we start with that acceptance. You're experiencing pain. This is what we can do to help you. And the answer isn't medicines. And I think that's where pharmacists are at risk, because that's often our background. We're there to, in community, we're there to sell medicines. And no, you're not. In healthcare, we're there to use medicines appropriately, improve the quality use of medicines, and that may be that we don't use them at all.
Yep.
Life is for living, and
Yes.
we want to encourage that.
Yeah, and you can live quality life with pain.
Absolutely.
Yep.
Yeah. Again, it's the very nature of what is persistent pain. We all experience pain. We've been experiencing it since we were babies.
Yep.
It's part of our physiological, psychological structure to recognise and respond to injury in particular. But also unpleasant circumstances and stress. We often increase pain in those environments as well. But persistent pain doesn't represent at this stage usually damage to the body anymore. The damage has occurred. This is memories. These are, if you like, the echoes, the ghosts of the injury now echoing around the body. And so we can. The whole idea is not to turn pain off. We can't do that. We have to tell patients from the very beginning, look, if you come to us for a cure, we're not going to be able to achieve that. What we want to try and achieve is that you're able now to live with your pain, with a quality of life, and also with an expectation that you can undertake movements. You're more functional, you're able to manage your activities of day living better. But don't think we can turn your pain off.
Yep.
The only way to do that is an anaesthetic, and that means that you're not awake, and therefore that's not conducive with living either.
Yes.
Again, what we're trying to do is often different to what the expectations of patients are. Patients expect, I think, we turn pain off. And they get quite shocked at times when you say, no, that's not what we can do. But then when they start to think about it, they often say, I knew that. This is actually what I've experienced.
Yep.
Nothing that I've been given has ever turned my pain off. And we use that nothing with your medicines has ever turned your pain off either. So why should we use something that isn't helpful?
Yep.
Let's move to something which is more helpful. And often that is moving to initially a more proactive management of pain. So you're using your analgesics on a regular basis instead of just when you think you need them. We move from short-acting analgesics that with 2 to 3 hours of pain relief only, and then the pain comes back, to longer-acting agents that try to suppress or keep the pain stable, so that then your biology is able to start to say, well, this is now my new normality, and start. Let's reset the scale. Let's just restart. Reset the expectations from the beginning. This is your level of pain. We want to try and now stabilise that, and we'll help you to manage flares of pain on that continuum, rather than thinking we can get down to zero.
Yeah.
So it's a challenging area, because as pharmacists, we've got to recognise that medicines aren't the answer. In fact, they can become part of the problem.
Yep.
And so we're now managing that, if you like, and that's where my role is such that I work with our medical staff in trying to help patients to understand what can be achieved and what cannot be achieved in pain medicine, which drugs are harmful and which are not, and there's very few that aren't harmful. And so let's use medicines that have reduced risk of harm as much as we possibly can.
Yep. Exactly. Well, I really want to thank you for your time this afternoon. It's been a pleasure interviewing you and getting all of your wise knowledge and your plethora of experience. And I hope that...
It's just being old.
Yeah.